bird's eye view of the medical world, Part 2. Yesterday, we looked at how expansive the scope of conventional medicine is. Evaluating it based on the education system, clinical practices, commercial aspects, governmental control, the pharmaceutical industry, the role of insurance companies, and society's perception of conventional medicine is important. Let us discuss each of these aspects from Ayurveda's point of view. If we look at the prevailing situation, most medicine aspirants turn to conventional medicine after completing their 12th grade. For students who are unable to crack the MBBS entrance exam, they enter Ayurveda as an alternative or backup career option. And since they have had no exposure to the concept of Ayurveda till this point, they obviously know nothing about it. What makes matters worse is the fact that a lot of students come from an English medium background or schooling, with no knowledge of Sanskrit. In most cases, what happens is that the students' parents are either allopathic doctors or not even related to the field of medicine, which further creates a void. In this situation, they opt for BMS or Ayurvedic education only because they aren't able to get admission to an MBBS course. This is happening in 97 to 98% of the cases. The result is that they don't know much about Ayurveda until they complete their schooling and enter college. However, at this stage, they realize that the curriculum or subjects they have been exposed to till 12th grade and those that are part of Ayurveda education are vastly different. They have never even heard of several concepts. Material science, a subject that is taught in the first year, for instance, is a good example. Because of the name, there is a common misconception that it might be related to physics. However, within the first couple of hours, this bubble bursts, and the students realize that this is something entirely different and seems otherworldly in nature. If they are lucky enough to have a good teacher, there is a chance that they might develop an affinity towards the subject and understand it. But this happens very rarely, and then the students are simply left looking at it as a necessity to pass their exams. If that is the case, whether you do BMS or MD or even PhD, you are never going to understand its true meaning. On the other hand, subjects like anatomy and physiology are preferred by students because they are correlated with conventional medicine and are considered essential since childhood. They spend most of their time studying these subjects, and the real Ayurveda subjects like Sanskrit, material sciences, and Ashtanga Hridaya are ignored or given lesser importance.